My name is Lorena. I come from Croatia and I'm an aspiring surgeon. And for this placement I chose the anesthesiology department, which I find really diverse and interesting.
My name is Eliza and I'm from Australia, and I am studying physiotherapy, and I've decided to, I'm part of the spinal unit, and so I've been doing physiotherapy there.
So I'm Roy and I'm from Hong Kong. I'm studying nursing in this university, and I came here for a graduate placement which I visit some cardio-surgical wards and also spinal and emergency ward, and I find it interesting.
For me, it was not the first time that I was in a clinical environment in hospital. I also previously shadowed a neurosurgeon at my local hospital. However, it was the first time that I was at pediatrics department, and I found it really rewarding to work with children, and it was interesting for me to shadow different mentors who have different approaches and who have also different approaches to patients, but also to parents and as well as to me. And they also, each of them found a different way to pour their passion for anesthesiology and surgery into me.
This is the first time that I've been in a clinical placement for physiotherapy. I have done quite a bit of sports placements, but this is the first time in clinical, and I found it amazing because I got to shadow the doctor as well as the physio, so it allowed me to see both the pathophysiology of the injuries and as well as the physical rehabilitation.
And so it was not my first clinical placement, and I used to have a year clinical placement in psychiatric setting in Hong Kong, but I find it so amazing and worth it to join this international placement because it is in the general setting, which I could not get the experience in Hong Kong. And the most interesting part of the program is that I come up with with a mental patients in the general work setting, and I have a lot of communication with him, and I find it and I have the opportunity to go to like operation centers and see all the operations like the spinal surgery and also some surgery about your fingers, and so I find it so good to join this placement. So the favorite mentor for me is the first week in the spinal unit, and she is like the nurse in charge of that ward, and her name is Lenka, and she is like so good. And then because like in Hong Kong it's just like so different, even if I got my opportunity to go to clinical placement, the nurses there are like unwilling, or they are not quite want to teach you something. But Lenka is like I shadowing her, and she teach me everything she knew, and then though she is already the nurse in charge of the ward, she tried to like demonstrate all the things for at once for me to let me have a full direction of how the ward functions. So I like her very much, and I want to thank you her if she will watch this video link.
My favourite moment on the placement was this afternoon when one of the patients that I'd been seeing almost every day was first time in the wheelchair, and so learning to drive the wheelchair, and so I got in one next to him, and Barbara, the physiotherapist, was teaching both me and him at the same time, and it made him really comfortable, and we raced up and down the corridor.
My favorite part of the placement was the part that I get to saw the diagnose part of the diagnosis and the treatment, and then after the few days I saw the improvement and the improvement in health status of the patient, and as well as the satisfaction of the doctors and their parents and families. I would advise the future placement students to really seize this opportunity and stay curious throughout their whole placement and really ask questions and interact with their mentors and with patients if they're allowed, and really use every moment to learn and prosper.
I would say definitely read over your materials so you know that the main complications and things that happen within your department, because then you can ask more questions and start from a higher level then, so that they don't have to explain everything to you. The tutorials are really good because they're a different department to what you're focusing on, but it gives you a wider range of knowledge. So you're not just sending this patient off for a scan, you actually know what that scan is and how it's doing it, and what's actually happening to the patient during that scan, so it gives you a background behind it.
And also for like the tutorials, we got like through the weeks, we got like 3 to 4 lessons per week, and I think they're really good because no matter like which profession you are in the healthcare system, it is like a multi-discipline job. And then like if you're a doctor, I don't think you don't need to know something about how to use the CT scan or how it works. So if you join this program and then you got the chance to have some tutorials, and the expert in CT scanning or expert in X-ray will tell you how they function and the mechanism inside, which you can't have this knowledge if you're like only specified in one profession.